We now have Changavy, a doctor who gained her medical degree from Imperial. Changavy moved to from Sri Lanka to the UK at the age of 9, and from the time we all met her has been one of the most determined people we have known. She sets her mind to various goals and always ensures she's worked hard, but also strategically, and networked in order to achieve them, whilst keeping the experience enjoyable with a balanced lifestyle. For example, an example of this is her presidency of Tamil Society at Imperial, where she developed her various skills further. During her time at university, she also co-founded and co-directed 11+ tuition service, Step Up Tuition Limited. Her career did not stop at medicine, as her passion for entrepreneurship was not something she was willing to sacrifice. Despite tireless hours at the hospital, she has taken the route of medtech by venturing into AI in healthcare. Changavy has shown that a degree in medicine has a plethora of opportunities, which I'm sure she'll be willing to explore further for you all. Without much further ado, can I have Changavy up on the stage, please?
Thank you so much, Vidya, for that beautiful introduction. Hello, everyone. Good afternoon. My name is Changavy Kajamuhan. As Vidya has said, let me take this off. As Vidya has said, I am a doctor. I work in Peterborough at the moment. I studied medicine at Imperial College, London. I graduated 2 years ago. And currently, I've just finished off my foundation year training, so that's 2 years in Peterborough, across emergency medicine, obs and gynae, and lots of different departments. So right now, in my career, I'm thinking of leaving clinical medicine and moving into strategy consulting for a little bit, before I then move into medical technology. So I'll touch on that in a little bit. But I'm aware a lot of you here are 14, 15, is that right? Between the ages of 14 to 19. So let's talk about where I started off. In terms of GCSEs, I chose options that I enjoyed. Looking back, at the time, I was really stressed about which GCSEs I was going to take. But actually, in hindsight, it really didn't matter. If you're thinking about what to do for GCSEs, I would suggest you go for subjects that you really enjoy, subjects that you think you're going to do well in, and you'll be fine. Okay, so that's all that matters in terms of GCSEs. And then going forward from that, for A-levels, I had no idea what I wanted to do. I wanted to study law at some point, I wanted to do engineering at some point, and then there was a part of me that wanted to study PPE. So I then decided to do what every Tamil does, and went into medicine. So for A-levels, I chose maths, further maths, biology, chemistry, physics, as a way of keeping my options very open. So that's what I did, and then I went into medicine. Now, I want to sort of preface my talk with 2 pieces of advice that my dad has always given me, and I would advise this for everyone else, and I think so many of you have already touched on this before. But the first thing is, whether you're at school or at university, your education is never in the classroom. It's always outside of the classroom. So obviously, you want to excel in what you're doing, but really, at our age, you know, I would still consider myself very young, and so are all of you. You want to be focusing on your transferable skills, like your communication skills, your teamwork skills. And these skills aren't always, going to be developed in the classroom, right? So, when your parents are taking you to all these classes and all of these things because it looks good on your CV, it's not just because it looks good on your CV, it's because it develops your personality, it develops your confidence. And it's these things that will then open up doors for you in the future. So it's not so much about your degree or what you study, but it's about who you become at the end as a person. And that's why it's so important that you seize your opportunities, you go out of your way, you network, you make friends, and you go to all these events, so that as well as excelling in your education, obviously that's for granted. So make sure you do all of these things throughout school and at university, so then you're then in a better position to seize these opportunities when they come your way. And the second piece of advice, again, something that my dad has given me, which I will give to all of you, is always say yes first, and then you can figure out the how after. If someone comes to you with an option, with an opportunity, at my age, I would say, yes, let's do this, and then you'll figure out the how after. So I'll go into what I did. So I studied medicine, but like I said, throughout medical school, I had a great time, and I integrated in a bachelor's degree in management. So this was very different to medicine, and it opened up so many more opportunities for me in terms of healthcare consulting, which is what I'll be going into. And I know Kajamuhan has already spoken about that, about what consulting is, so I'm not going to go into it in much more detail. And I think with medicine, there's I think in the NHS, 1 in 10 doctors are of Tamil ethnicity. So, there's a lot of us who are doctors. But I think it's important to remember, especially in the current climate with doctor strikes and, about pay progression, career progression, and all of that, I think it's important for all of us to remember there's a lot more you can do with a medical degree than just going into clinical medicine. Okay, so it's, with a medical degree, that's nothing to say that you have to be a doctor, that you have to be in clinical medicine. Obviously, if you want to, then that's great, but there's a lot more you can do with a degree in medicine. Medicine is a unique degree. It combines hard sciences and soft skills in a very unique way. I think once you work as a doctor for a few years, you'll be able to, you've got the skills to communicate with such a wide range of people. You'll be seeing patients who are homeless, and then the next patient you see will be completely different. So it opens your eyes to so many parts of society that I wouldn't have seen otherwise. So it's an incredible degree to have. And I think, if you are thinking of doing medicine, but you're put off by the current climate or anything else, I would encourage you to rethink that, because it's a very good degree to have. So, why medicine? Like I said, it's a unique degree, incorporates so many different things, hard science, soft skills. It's got all of that mixed in, a little bit of ethics, a little bit of law. So I think it prepares you really well for whatever else it is that you want to do. During my time at university, I had the opportunity to do an internship with Data Science for Social Good in association with the University of Chicago. Obviously, at this time, did I know anything about data science? No. Did I know how to code? No. But did I say yes? Yes. Because, you say yes and you figure out the how after. So I went to this internship, and I had 2 weeks to figure out how to code and how to learn all of these things. So I gave myself 2 weeks to come up to scratch with what I signed up to, and it opened up to the world of medical technology for me. So we live in a time now where, right now, the way medicine works is, you get ill, you go to the hospital, you get treated, and then we send you back to the community. Okay, but we're now moving towards that because we don't have the manpower to match our population to be able to do that. So naturally, we want to be moving towards a preventative healthcare system, right? So all of us have smartphones. We're now trying to see how we can use data, how we can use numbers about, so your blood pressure, your readings, all of that about you, how we can optimize your diet, your lifestyle to prevent all of those diseases in the future. So medical technology, and especially using artificial intelligence, is an up-and-coming sector, and we have so many medical devices that are trying to come into the market, but we have a shortage of clinical safety officers to sort of approve those things, because that's another thing that people don't really know much about. So you have lots of people who are doctors, you have lots of people who are doing artificial intelligence, but you don't have people who know both of these coming together to make that work, to pump that into the NHS or to any healthcare system to make that work. So this is a niche that I want to be going into in the future. So I've just lost my train of thought there. So in terms of artificial intelligence, there are so many people I know who have done a medical degree, and then they've gone on to do a master's in computer science and coding, for instance, and they've now started up their own ventures backed by venture capital, and are now pumping that into the NHS. So if you are interested, and like Kajamuhan said, if you're opening up your LinkedIn, these are people I would suggest you connect with to find out more. So there's a person called Ivan Beckley I would recommend, who's a friend of mine who has done medicine and then went on to do a master's in computer science, funded by Google DeepMind, and he now runs a company based on proactive healthcare. Okay, so there's a lot more you can do with medicine. I would completely recommend you if you want to do medicine but you want to do something else, I would completely recommend you do medicine. And At this age, I would recommend you optimize for your exit options. Okay, so I think medicine gives you a lot of good exit options, as does strategy consulting. Personally, for me, I see myself going into venture capital in the future. So I want to be working with startups, medical startups, but I want to be working in venture capital. So you identify these startups and you can decide which ones you want to fund. But really, at this point, I think, it's important to think about why, what it is that you want to do. But before you think about what it is that you want to do, I think you want to be honest with yourself and think about why is it that you want to do what you want to do. What is your purpose in life? And I know that changes throughout your time. At 14, my why was very different to my why right now. But for me, when I was 14, it was just to make an impact on people's lives. And at 14, that's all I saw myself doing. I wanted to make a change to people's lives, and to me, medicine was the best way to do that. But as I grow older, I want to make system-wide changes. I want to be making an impact on people's lives on a wider scale. And again, I'm so glad I did medicine because it gives me a good stepping stone to be able to do that. Okay, so I think that's all I wanted to say. I think in high level, it covers what I wanted to say in terms of all the other options that you do have open for you. Thank you so much for having me here today, to Lotus Caring Hands, to Young Lotus Caring Hands, and in particular to Uma Auntie. When I first moved to this country, I didn't really speak much English at all, and it was Uma Auntie's house that I first went to. She was instrumental in forming my sort of early career, and where I am is, I owe a lot to you, Uma Auntie, and to all my, all the family and friends here today. So thank you so much, Uma Auntie. And if you have any questions, I'm open to questions. No?